contact tracing is seen as a key tool in the path forward in reopening the economy. So when Apple and Google, two of the fiercest rivalries in tech, announced that they would be working together on a program, it was seen as hugely promising. Together, they cover virtually every smartphone in the world. But as they got closer to deploying the actual technology, expectations are being scaled back dramatically. Today, they made the tech available for public health authorities, but they say that it can't provide necessarily effective analysis. It can't actually tell them where an outbreak is occurring. And that's where Apple and Google and digital contact tracing at large run into a sort of catch-22. For it to work, it needs a large number of users to opt in and use it. But for people to want to use it, they don't necessarily want to hand over their personal location information to big tech and the government, so it loses its utility. Scott, this is less of a problem, certainly in places like China and Singapore, where there are less concerns around privacy and location data. But certainly here in the United States and in Western Europe, this program is running into enormous challenges before it even gets off the ground.
Absolutely. Deirdre, thank you. That's Deirdre Bosa reporting for us tonight. Dr. Gottlieb, I'll bring you back in. Wondering how we should think about contact tracing, the issues of privacy and other things that may crop up as we're trying to hire tens of thousands of people around this country.
Well, look, we're going to have to do contact tracing if we want to try to contain this spread going into the fall. We can do it the old-fashioned way by interviewing people who are positive, trying to find who they were in contact with, go and offer those individuals testing. Or we can use technology as a tool to help accelerate this. What Apple and Google built was basically a platform, a pipeline, if you will, to do contact tracing using electronic tools in a very de-identified way. So they actually built a platform that protects people's privacy. What that platform enables is to say that person A came in contact with person B, but it doesn't tell you where those two people came into contact, and it doesn't necessarily tell you who person A and person B are. That information can be available to the user if they want it, if they opt into it. And so they built a platform that actually allows for anonymized contact tracing. It's up to public health authorities in terms of how they use that information. Businesses also need to think about contact tracing in the workplace because there will be positive cases in workplaces, and businesses are going to have to figure out how they get in touch with employees who may have been in contact with employees who end up being positive. And so, you also need to think about contact tracing in the workplace, not just at a population level.
Yeah, the clock's ticking, obviously. When do we need to start with the contact tracing?
Well, we should be starting right now. I mean, this is one of the measures you want to have in place as you reopen. And this sort of case-based intervention, trying to target individual cases as opposed to the population-based mitigation, which is what we've been doing, which is targeting the entire population. That's what you want to be doing. That's how we're going to control spread without having to resort to these sort of stay-at-home measures, these very onerous restrictions that we've been putting in place up until this point. So we want to be doing that right now. Hopefully, if transmission does dissipate as we get into the summer, you want to make sure that these tools really are in place in a robust fashion getting into the fall. And you also want to make sure you have in place better screening. The challenge going into the fall with the testing and the screening isn't necessarily going to be the platforms for conducting the testing. We're going to have a lot of platforms for actually running the tests. The problem is going to be, where do you go to get the test? There's going to be a lot of places that don't want to do testing because they don't want the implications of having positive cases, either in a pharmacy or even in a doctor's office. It may well be in the fall that when you call your doctor and you tell them that you have flu-like symptoms, they don't say come in. They say go to one of these special COVID testing sites and get yourself tested for flu and COVID. And if that's the case, if it's harder for people to go get tested for COVID, fewer people are going to get tested. So we need to figure this out right now. How do we encourage testing, and how do we build easy places for people to go get screened for this virus?
You think there's the wherewithal tonight to tackle those very difficult questions that you just raised, Dr. Gottlieb, that you say need an answer now?
I think states are certainly thinking about this and working on it. I'm talking to the governors in Maryland, Massachusetts, Connecticut, New Jersey as well. The states are certainly putting in place programs to deal with these kinds of challenges, the contact tracing, hiring the public health staff, thinking about using electronic tools to augment that. Where do we go to get screened? How do we create testing sites? And also getting testing into settings where you have at-risk populations. That's really key because not everyone's at equal risk of getting COVID. We know people in nursing homes are uniquely vulnerable and uniquely at risk. Also, people who work in certain professions where it's a high-touch profession, you come into contact with a lot of people and you can't naturally social distance. So we need to get testing into those sites. A lot of states are thinking about that. I've talked to the Connecticut governor yesterday. I was talking to him. Connecticut's working on that, my home state, on how to get testing into at-risk sites. These are the kinds of things that states need to be working on right now, and a lot of governors are doing that.
You're a man in high demand, including from our viewers tonight who have questions for you once again, Dr. Gottlieb. I'll run through a few if I could. Chris Munzo has a question for you. Florida's about to lift our ban on short-term rentals, he says. Our beach communities will be filled with travelers from dozens of cities. Is this a good idea?
Well, look, we have to see what the risk is going into the summer. It's all going to depend on what the prevalence is and what the background risk is. If we have lower levels of risk, transmission breaks off, and we're doing good screening, and Florida has stepped up their testing, and so have a lot of other states, so we know who's traveling down to Florida. Maybe we can all take a little bit of a breather going into the summer while still practicing good social distancing and good hygiene, which is going to continue to reduce our risk. I think it all depends on what ends up happening this summer. Hopefully, we see the cases continue to drop.
I mentioned how we've all been cooped up. We're looking forward to getting out, and maybe this weekend is the weekend that many more people do because it's Memorial Day weekend. Matt Lozar asks you, Dr. Gottlieb, when should families from kids to grandparents feel comfortable getting together in groups of 10 to 20 people? Should they stay outside? Do they need masks inside?
Well, things done outside are safer than things done inside. We know that there isn't the same risk of transmission to large groups outside as inside. I think it all depends on your social group and how much you trust your social group and what kinds of circumstances they may have exposed themselves to and what kind of risks there are. Obviously, I talked to a lot of individuals, ourselves. People are starting to expand their social circles a little bit very carefully with people that they trust. And I think within a family, you have a sense of what you can trust.